As COVID-19 cases are spiking at an all-time high since the spring, WRTV is continuing to hold the governor and state leaders accountable about your health. Our Stephanie Wade reports on where we're at right now and the governor's response.
Today is now the 14th consecutive day with more than 1,000 new cases of COVID-19 in Indiana. An even grimmer statistic. 48 deaths were reported today. That is the most deaths reported in a single day in Indiana since May, when we were in Governor Eric Holcomb's phase 2 of his Back on Track plan, ranking the Hoosier state now with the 15th highest rate of cases in the country. A total of 1,425 Hoosiers are also in the hospital right now with the coronavirus, according to the State Department of Health. The last time we had over 1,400 hospitalizations was also in May. Indiana's 7-day positivity rate for unique cases is at 12.4%, but some counties find themselves hovering 20% positivity. We asked the governor today if he will make any changes as a result of this. His office referred us to what he said Monday.
Well, we'll know when we see it. Look, again, we are monitoring from the very beginning our 4 principles, and that has all to do with the amount of testing. When you're doing 20, 25, 30,000 tests a day, your radar is going to become even more transparent about what is and isn't and where it is and isn't. So we're seeing more cases. That's a good thing. We're also tracing to an extent like never before. And we have the capacity to care. So when that starts to become threatened, that capacity to care, then we'll look at additional measures.
Stephanie Wade, WRTV.
We expect to have another COVID-19 update from the governor and state leaders tomorrow. You'll want to stay connected with us at WRTV for that update. Late this afternoon, we did get this statement from the Indiana State Department of Health, quote, "Today's total includes deaths that occurred over the weekend but were not reported until today's dashboard, which is something that we see frequently. As Dr. Box has said, being in stage 5 does not mean that Indiana is back to pre-pandemic times, and Hoosiers need to continue to wear masks, practice social distancing, wash their hands, and stay home if they're sick in order to curtail the spread of the virus. Throughout the pandemic, we've asked Hoosiers to consider their own health and risk factors, as well as the risk factors of their close contacts when making decisions as they go about their daily lives," end quote.